Vince, whenever you're ready to speak.
Members of the board, Vice Chair Semi and Chair Adams, come to you representing myself and Mid-Valley Healthcare Advocates. Thank you for considering the proposal we bring to you. I am Michael Huntington, a retired physician who has lived in Corvallis since 1984. My wife, Carol, was a music teacher in the district for 20 years. Our two children benefited from a wonderful education here. One is now a nurse in Denver, the other a construction management business owner in Dana Point, California. I'm fully aware that we and our children were fortunate to have healthcare when we needed it. Our kids would not be in the positions of success that they are in had they been without healthcare or the quality of education they received. Sarah, the nurse, had asthma that, if not controlled, could have taken her life or her opportunity to thrive. But for the luck of the draw, she was and is now not in the 1/3 of our population that cannot access adequate health insurance or health care. My interest in the universal health care began about 20 years ago as I was nearing the end of my career as a radiation oncologist. Patients were coming in with advanced cancers at a time when we were getting better at diagnosing cancer early. You probably know what was happening. Weight loss, pain, shortness of breath, pretty worrisome, especially in the middle of the night. But the fear of cost can be even more worrisome. Patients would wait months and finally be forced to come to the ER because of a crisis they couldn't ignore any longer. That's how I got acquainted with the ER docs. We would be unable to control the cancer. And as if the emotional stress of fighting cancer were not enough, patients would face the added stresses of financial hardship, sometimes loss of home, unbearable. A nurse overheard this conversation between the patient and his wife in an exam room. They say I have stage 3 lung cancer and that I need chemotherapy and radiation therapy. They offer no guarantee of success. I'm going to refuse because I don't want to leave you and the kids homeless. Our healthcare system should be called a sick care system because the finances that sustain it are generated by treating sickness. Incomes for hospitals and care providers depend on us getting sick or injured. The absurdity of that has come to light during the pandemic. 80 hospitals have closed. 20% of our hospitals have closed because they have not been able to earn the usual income from surgeries and other procedures, just at a time when we need those hospitals the most. The existing system is really causing havoc in all aspects of our lives because of its unnecessary complexity and cost. This is why we are here and hope that many voices, including yours, will let our legislators know we want everybody in, nobody out. Publicly financed universal health care for our students, school staff, and all Oregonians. Incidentally, there will be a virtual town hall on Oregon's efforts to achieve state-based universal health care on Wednesday, January 6th. Dr. Junkins will be one of the 5 panelists. The town hall is sponsored by Mid-Valley Healthcare Advocates, League of Women Voters, Casa Latinos Unidos, NAACP, Corvallis Albany, Rural Organizing Project, and the Corvallis Sustainability Coalition. If you want to join that, go to mvhca/town-hall. Thank you for your attention.
Thank you, Dr. Huntington. And I appreciate your inputs. Is there any questions for Dr. Huntington? Vince?
Well, first of all, thank you, Mike, for coming and speaking to the board. And you and I have had numerous conversations about universal health care. And I would just like, can you reflect briefly on your experience on, what the impact has been on families, and particularly children, when you were practicing as an oncologist? What was that impact on children that you observed as a physician? And then I would also ask, would you please send the link for the summit to the board?
Yes, I will. In my practice, very few of our patients were children, but of course, the adults, many of them did have children, and they faced this very unbearable question that you just heard the little story of, leaving your children or your family without adequate finances or even a home. This is still happening. It's happening every day. So I don't know if that gets close to answering your question, Chair Adams.
Yeah, it really does, and thank you for speaking to that. Um, I strongly support universal health care for Oregon, and I appreciate you coming and speaking to the board. By the way, Sammy is the board chair. I'm no longer on the leadership team.
Okay, thank you, Chair Sammy. Yeah.
Thanks. Any further questions? Thank you, Mike. I appreciate you really leading the work on this issue. It's very important. I appreciate it.
You're welcome.
All right. Next up is Dr. Ed Junkins, and I would make sure I am sure you heard the script so many times, so I'll save you from that. And the floor is yours whenever you're ready.
Thank you very much, Chair Algebra, and members of the school board administration and other guests in the room. Thank you for the opportunity to speak. Once again, I miss my time on the board. I miss all your faces, and you guys are doing fantastic work. So thank you for that. What you have before you is a resolution which obviously many of us physicians are very much behind, which should tell you, quite a bit about the importance of the resolution. The details of the resolution deserve a little bit of attention, and that is really from the start, the ability of students to learn and benefit from classroom experience depends on good health. This is why a couple of years ago, we created that board goal of wellness. I am proud of a handful of things that I've been part of in my life. 5 of them are my children and my relationship with my wife and family. And the other things are the things I've done civically in the community. One of them is my work on the school board, and that is our equity goal and our wellness goal. The wellness goal very much asks the board to think about and to get behind the resolution that's before you. I just want to, as the co-chair or vice chair of the task force of universal healthcare, I just wanted to bring us back to a couple of parts of the Senate Bill 770, just so that we're all clear on what we're supposed to be doing as a task force. The task force on universal healthcare is established to recommend the design of the Healthcare for All Oregon Plan, a universal healthcare system administered by the Healthcare for All Oregon Board that is equitable, affordable, and comprehensive, provides high-quality healthcare, and is publicly funded and available to every individual residing in Oregon. So these are the details which we are presently working on how to deliver on that. The Task Force on Universal Healthcare shall produce findings and recommendations reported to the Legislative Assembly as provided in Sections 6 and 8 of this 2019 Act for a well-functioning single-payer healthcare financing system that's responsive to the needs and expectations of residents in the state. Can you imagine a world where we didn't have to worry about our employees' wellness, where the funds that we had in our district can be shifted from wellness, from funding healthcare to more teachers or paying for more custodians? I remember that, Ryan. I remember talking about how do we get more custodians in our schools, more nurses, more of all sorts of things. So this is why in the various healthcare settings where I've worked and where I've done this advocacy work, including inner city Baltimore, the Navajo Reservation, inner city Salt Lake City, and now here in Oregon, I've seen healthcare access from every possible perspective. And it's not just about do you have insurance? It's about access to quality care. As Dr. Huntington said, we have individual stories of families that are not able to move from day to day. Imagine what that learning environment is like in those homes. So, resolution before you, happy to answer questions. And again, thank you for the work that you've done for our community, and I miss you.
We miss you too. I want to provide a clarification or request. First, I'll start with the request. If you could, I received that over email sample language of a resolution, and I would like to ask you if you could send that to the board email so all board members could receive it. So that's the request. And the clarification for fellow board members, as a matter of procedure, any resolution can be introduced by school board members by sending it to the chair, and it will be prioritized through the board leadership in a future business meeting for a first reading and then for passage. So with that, I would like to open the floor for any questions for Dr. Ed Junkins, and we have Vince.
So really just a suggestion. I think, as I said before, I'm already sold on the idea of universal healthcare for the reasons that both of the physicians that have spoke for the board this evening have cited. So I would ask that we set aside a time to consider the resolution and also invite back both Dr. Huntington and Dr. Junkins and other physicians to educate the board more fully on this issue as we consider that and taking it up and potentially giving advocacy to this effort.
Wonderful, thank you. Any other questions? We have Kate Bolts.
Yeah, I just want to say, from the perspective of a student, we understand, I think CV, at least a lot of the people I know are privileged, but not everyone even in the Corvallis School District has that kind of privilege. And I know OHP only covers low income communities, but that's not fully, it's not everything. And so I know that a lot of people I know would very much support this. I do as well. So I just wanted to say thank you for coming to talk to us, and it's a great work that you're doing.
Thank you. Point of clarification, and since we do have both speakers here, I'll open it for either one of you to speak about it. I just want to clarify, the resolution you're advocating for is for Senate bill statewide. It's not only for a district or for a municipality. This work to be effective, you're asking for us to advocate for it on a state level. Is that correct?
Dr. Huntington, you're muted. If you want to respond first.
Yes, primarily for the state level, but ultimately the national level would be very desirable, even more desirable. But starting with the state level,
there have been other efforts. Vermont, Colorado, New York, California is trying it. All of them have come close, have had problems along the way. Oregon could be the first state to get it absolutely right, to be the model for a national plan. And what's unique about what our group is doing, never mind we have input from every possible perspective you can think of, but what's unique about this is the current setting in which we are doing this. We're doing this virtually, like we are doing this now in a pandemic where we are all in the same storm, and you've heard this. We're not all in the same boat, and we have extremely disproportionate outcomes. And so that provides a very credible, relevant, and urgent layer of momentum for the work that we're doing. And so we're going to put forth what I think is a really exciting proposal. It will require you and your constituents and your influence to convince the voters that this is what we need.
Well, thank you very much. Any further questions? Seeing none, I want to thank both public comment speakers, and the public comment period is now closed. Thank you very much. And next item on the agenda is action on matters discussed in the December 10th, 2020 executive session.